give a paper on studies of psychoanalysis at our university. I want to deal with a very difficult problem, which is what kind of scientific discipline or scientific background has psychotherapy. Is it even a scientific discipline, or is it a practice? Just a practice? No. The first and most easiest definition that it is a scientific discipline is because it is taught at the university. And not at only one, but in many universities. We could think that this is enough, but surely it is not enough. It is just one aspect of the discipline. And before I go into history of psychotherapy and the development of psychotherapy in this scientific sense, I want to stress out how big the problem is. We know that in former times people suffered a lot of emotional disturbances, anxieties, depression, psychosis, personality disorders, etc. We have evidence since the Middle Ages that there were already registers like the ICD-10 and the other structures to understand emotional disturbances. But nowadays, it looks as if the situation accelerates, the emotional problems become epidemic. And I want to mention two studies which show the evidence. One study was done 2 years ago in Germany, surveying the emotional illnesses in the European Union. And the result was that about 30% of all illnesses are linked to emotional problems. It is an unbelievable big number. It is so big that the health systems did not catch it. Because what should they do? They would have to change the whole health system when they take it for serious. I remember there was a meeting of the health insurances in Austria, where I come from, and they were discussing this topic, asking the main psychiatrist in Austria, and he said, no, don't worry, the problem is not so big as the numbers show. So, this is one investigation. One could have some doubts. But the second one, we cannot have any doubt. This was done in Austria by the health insurance itself. And they were looking how many people get a prescription for some emotional problem. They counted the prescriptions. And the result was that about 12% of all people get some kind of prescription. Prescription, hospitalization, or psychotherapy. So the market is extremely big. But it's interesting, about the number is a little more than 900,000 people. These are 12% of Austrian population. The big group get prescription from the family doctor, from the practitioner in the medical field. They get prescriptions mainly for pills. 70,000 get hospitalization because they need some safe environment when they have psychosis or drug addiction or similar manic depressive disorders. And 75,000 get fully paid psychotherapy, so about 8% of them. So the majority pills, mostly antidepressants and anxiolytics. So the problem is huge, and the society asks for help. And here we step in as psychotherapists. Besides all different creative schools and sometimes a little narcissistic self-reflection about our schools, it is necessary to see in which frame psychotherapy is implemented. Modern psychotherapy, we could start, it's always a discussion, but I would say we have at our university, we have a discussion, when does psychotherapy start or started? And there's the one fraction which says psychotherapy started when the word psychotherapy was formulated. And the other fraction says no, psychotherapy is an old discipline coming out of the tradition of traditional healing, of shamanism, and developing towards a profession. This is my fraction, I have to say. But we could say there was one point in the midst of the 18th century when Franz Anton Mesmer was formulating a concept which says it is not anymore something which is related to God, which is related to sin and to religion when you have an emotional problem, but it has to do with some energy. It's quite interesting because this energy concept is very old in China, Qi, and was also used in the 20th century, for instance, by the bioenergetic colleagues. And it means that there is something in the air which makes some troubles. The concept of transference and countertransference at that time was not developed. It was not even also not developed that we are learning unsystematically, normally, how to deal with problems and how to fail in dealing with the problems. This was the achievement of the 20th century. But this turn away from religion towards something what is in between the people, energy, was the main, from my point of view, the main starting point for modern psychotherapy. Still connected with mythological ideas. So I just mentioned Busegur, or Charcot. The main development in psychotherapy in the 19th century was in France. France was the big nation for psychotherapy in the 19th century. They had the idea, for instance, that certain trees have some special energy, and when you embrace this tree, and they figured out some special trees in the country, then you will be healed. And there were some specialists, hypnotic specialists. They went to these trees and touched them and filled them up with energy, so to say. So very mythological, and from our point of view, it is still a little religious. It is the same when you touch the old bones of some saint person, and then you think you feel better, and maybe you feel better. Presumably they felt better because it was a wave of treatment in the 19th century, in Middle Europe, especially in France, in England, and also in Germany. Nowadays we can look back with a little smile, but at that time this was the psychotherapy of what we do now, and where our followers in 200 years will have a smile, presumably. There are so many activists, developers in the field of psychotherapy, but certainly, as I always say, Mesmer is our grandfather. Sigmund Freud is the father of modern psychotherapy, because he was the first to develop a system, a psychic system, and a treatment method, and a theory, a very metaphysical theory about something, what you cannot see, what you cannot observe, about the unconscious. So, a theory about what we cannot speak about because it's unconscious. It's quite an interesting concept, and I would not say it is a theory, it is more or less a hypothesis to work with. And with Freud, the modern discussion started very intense. What kind of philosophy, treatment, discipline is psychoanalysis, and later on psychotherapy? Is it a medical model where you have to learn what you have to know and what is proved and then apply it to the patient? Or is it more as Freud said, a talking cure, which has nothing to do with the medical model? And Freud himself was very skeptical about the result of psychotherapy, and psychoanalysis especially. He thought it's not a very good method for treatment, but a good method for philosophical knowledge, he said. Nevertheless, we are torn between these two concepts. On the one hand, the medical model to heal people, and there are tremendous big groups in society, as I said before. And on the other hand, an instrument for insight, for relationship, and for understanding one's own identity and some kind of effort for enlightenment. When we speak of this group, we have difficulties to understand it from a science perspective, in the sense of natural science, because in fact every case is a special one. So we are a discipline of understanding single cases. I remember very well when Carl Rogers was in Vienna. I was a young psychotherapist of 25 years, and we squeezed him about his understanding. And I think that Carl Rogers is, after Sigmund Freud, the most important and influential psychotherapists in the 20th century. I will explain to you why. But we asked him, what do you think about the different psychotherapy methods? And he said, well, every psychotherapist must develop his own method. And I add, and every psychotherapist must develop an own psychotherapy with the client or patient he treats or she treats. And in this point, he is extremely radical. Because he throws back all the creative, splendid ideas school founders have. And we need to develop a frame to understand what the school founders, the school theories are all about. How can we understand that it is possible to dream in a psychoanalytic way, or to have a dream in a Gestalt way, or in a way of transpersonal psychology. I have a friend, Dr. Fischer, who investigated dreams of Freudian, Adlerian and Jungian patients. And it was quite funny that they dreamed about according to their school, because the interpretation was according to the ideas the psychoanalysts had at the back head. And Freud himself said, it's interesting, always when I have a new theory, I can find it with my patients. And this is the strongness and the weakness of psychotherapy as a discipline. Because we are not a traditional science. I remember Grünbaum, I don't know whether you know him, he was one of the famous neo-positivists criticizing psychoanalysis. Excellent. And he also made the mistake, from my point of view, to not to understand that the psychotherapy is an experiential discipline. And it's not a logic discipline. It cannot be a logic discipline when A can be A plus at the same time, as we know from our patients and from ourselves. So I would say it is a scientific, psychotherapy is a scientific discipline because we are questioning what we do. And we put it in a frame where we can find arguments why we have this frame. We are also using other methods besides the hermeneutics to explain outcome of psychotherapy. We use measurements for the process of psychotherapy. But the core of psychotherapy is hermeneutic, is text interpretation beyond all disciplines, all methods of psychotherapy. And when we understand it in this way, every psychotherapist is we could say, a composer of and a creator of the psychotherapeutic situation, but also a contributor to the broad field of scientific psychotherapy.